Hi, Professor and fellow classmates. My name is Carmen Price, and this is my presentation on trauma. The first person that I'm going to address would be a child that is coming in for trauma therapy. It's a little boy. He's 7 years old, and about a month ago, he experienced being in an earthquake. The family was not harmed, but there was some damage to buildings nearby, and he could definitely see the damage when he walked outside, like trees being down and things had fallen on some cars and things like that. His mom called and set up an appointment because he's been having nightmares since, and he's also been complaining of stomach aches. And she's taken him to the doctor, but they can't find a physical cause for the stomach aches. This is a first session, and here goes. Hi, Jimmy. My name's Carmen. I'm really happy you came in to talk to me today. Your mom told me that you've been having some belly aches lately. Can you tell me about those? And I would wait for the client to respond, of course. Did you maybe eat something that didn't sit right in your belly? And then once we determine that it's not anything he's eaten or doesn't feel sick. Well, your mom also mentioned to me that there was an earthquake where you live recently. Can you tell me a little bit about it? And then I would give him time to respond. Things were shaking around you, and you were in your bed. That must have been scary. Well, I want you to know that this is a safe place, and you can tell me anything you'd like, and anything you don't want to talk about, we don't have to talk about. But hopefully, after a couple times of us meeting and talking, maybe we can get those belly aches to go away. And with a child, I would also probably try the intervention of art therapy, similar to Perry with some of the children, where he would sit in the floor and kind of get down on their level so that you're not intimidating them, and let them just color or draw while you're talking. A lot of times, this makes them not as scared or feeling like you're being confrontational with them because they don't have to look you in the eyes. Okay. For the next segment, I'm going to be talking to a female adolescent, and she was the victim of a date rape about a year ago. She is now almost 16 years old, and her mom has noticed that slowly over the last year, she started to withdraw. She doesn't want to go to social events. She quit the two sports she was playing at school. She doesn't like to even go over to her friend's house after school to hang out anymore. So she's really withdrawn. And she's also noticed a few marks on her arm that she told her mom were from cat scratches, but her mom is a little worried that maybe there's something more going on, that maybe she's self-harming. Okay, so this is how I would address, oh, sorry, shaking. This is how I would address an adolescent client. Hi, Jenny. My name's Carmen. I really appreciate you coming in to talk with me today. Did your mom tell you a little bit about what it's about, what you're coming in to talk to me about? Well, why don't you tell me where you'd like to start? What would you like to talk about today? And then, of course, because it's a teenager, they would probably respond with something along the lines of either, I don't want to talk, nothing's wrong with me, usually something to that effect. And with a teenager, because there are issues of trust that have to be formed, of course, I wouldn't jump right into talking about the trauma at all. First, I would try to bond with them and develop some kind of rapport. because when they trust you, they're going to be more willing to talk to you. So the first probably 1 or 2 sessions, I would just get to know her and talk to her, and hopefully she would feel a little more comfortable talking to me as time went on. When we did get to a time where she felt safe talking, at that time I would probably bring up um, that, sometimes things occur in our life that we don't know why they happened, and it's not fair that they happened. Um, but sometimes it helps a lot to talk about those things. Is there anything you'd like to talk about or get off your chest? Hopefully at that point, the client would disclose, um, even if it's not in details, just maybe kind of gloss over the event, bring it up. Once they do disclose the event, because I would never want to like poke or prod, I would wait until they feel comfortable talking about it. Um, then I would probably let her know that when we experience something like that that can be so scary, it can affect us in a lot of different ways. Um, it affects not only, how you think, how you feel, but it can also affect your body. You've probably heard of the fight or flight response, um, and then most people have. But there's also a third, and that's called freeze. Um, it's similar to daydreaming. When the body is so scared, sometimes it shuts down, um, and this daydreaming, it's called dissociative. Um, have you ever felt like that you were just maybe um, doing something, and all of a sudden, sort of your mind sort of wanders off? And then, depending on what she says, we would talk more either about the dissociative states or about self-soothing. And eventually, I would also keep track of if I was seeing more marks on her, if I thought she was self-harming. And once I felt that trust between us, I would probably ask her, what's that on your arm? Or did you hurt yourself? And see if she's ready to talk about it, if she's ready to disclose. And again, if she wasn't ready at that time, I wouldn't push. I would wait until she was ready to talk. Okay. The last client that I would speak with, this is an adult client, and again, it's going to be a female. She experienced sexual abuse as a child from her biological father from the ages of 6 to 14. She did not disclose the trauma. However, she also has a smaller sister, 2 years younger, that did disclose at the age of 12. They reported it to authorities. There was a trial. So he is now in jail. She is an adult, late 20s, 27. And she's had a lot of trouble in her life. She's had drug abuse problems. She's had multiple arrests. She also fell into abusive relationships. So I would be able to talk more to her about the exact theories behind trauma and how it affects every aspect of humans, of people's lives. Okay, so here's how I would address her. Hi, Shelley. My name's Carmen. I really appreciate you coming in to talk to me. I got a little bit of information about what you wanted to come in today, but I'd like to hear it better from you. Could you explain what you'd like to talk about, or what we could work on together? And then, of course, I would hear from the client what they came in for. Usually it's not the trauma immediately. Usually it's some other kind of, not superficial, but like a surface problem that they come in for, and later the trauma is disclosed. So once we get to the point where the trauma, either I feel that they're getting close to disclosing the trauma, or they are actually disclosing the trauma, I would then let them know. There's a famous, I guess, psychologist named Rothschild, and her theory on trauma is that it affects not only the brain and your emotions, your reactions, but it also affects your body as well. So we can look at all the different areas where you feel that maybe these past experiences are affecting you now. And once we figure those out, then we can work on treating them, so that you can get back to living your life the way you want to. That way, what happened in the past is no longer controlling you. Um, so, what would you say is bothering you the most? If she explains something as far as being scared, or not trusting anyone, whatever she discloses, that's where I would start at. And then usually as the work goes along, more would be disclosed. And then we could pick different areas to work on. And I would probably do them one at a time. I don't think I would want to address all the areas at once, because I think that would be very overwhelming. I hope you I hope you enjoyed this presentation, and I look forward to seeing you all in the next class and learning so much more. Thanks.